My name is Ishil Khan and I'm the founder of Dot Inc. and my company is for children with mental disorders. So we're developing our own EEG headset that would essentially help with the diagnosis as well as the treatment. These devices read your brainwave activity. What we do is run algorithms in the background that have already been clinically validated to be able to diagnose ADHD to begin with, and then later on we want to ripple down into other mental disorders as well. Good afternoon, ladies and gentlemen. My name is Ishil Khan, and I'm the founder and CEO of Dot. And we have developed a neurofeedback headset to provide quantitative analysis as well as therapy for children with attention deficiency hyperactive disorder. So while surveying families with ADHD, I met Jacqueline. Jacqueline knew there was something wrong with her son at a very young age. She was embarrassed to take him into public as he would throw tantrums. Soon enough, she started getting complaints from teachers and others. It was not until 4 years later that Jacqueline decided to take him to a hospital. It took another year for him to be diagnosed. Jacqueline had to relocate to seek proper treatment. Michael, on the other hand, started failing at school. He felt lonely and withdrawn. ADHD is the most common mental disorder, and it impacts 11% of all child population. The annual cost per family is about $3,000, accounting to $27 billion being spent. So as you saw in the case of Michael, 5 precious years of his life were wasted. This is inefficient. Parents often have to spend a lot of time and money before receiving a diagnosis. The results of medication are based on trial and error. Our solution is effective, affordable, and accurate. We give the parents a diagnosis and a direction within minutes. Parents can use our device from the comfort of their homes. Our results are based on the child's EEG signals, which means it's data-driven. So our headset would be sold directly to parents who can then download the application, which serves 2 main purposes: monitoring and therapy. For monitoring, we read the child's EEG signals and then help inform the parent when it's time to visit a doctor. The algorithms that we use for diagnosis of ADHD have been already clinically validated. For therapy, we provide interactive games that use clinically proven techniques of neurofeedback to better the child's condition. We also track the child's overall development and make suggestions based on personalized data. And if you guys would like a live demo, please stop by my booth at the back and I'd be happy to show you. So if I'm to summarize all that fancy pep talk into 2 slides, this is what it would look like. What we aim to do is move from the 19th century to the 21st century and bring this technology that already exists in a clinical setting into the consumer home. For the first 5 years, we will be looking at 7 to 12-year-olds, and we have a plan to reach 11% of the stated market shown here. We have already tested with the diagnostic platform, and currently we are testing with the games that we have developed in-house. We will be launching our Kickstarter campaign after that. Initially, we will be a B2C company, and 3 years down the line, we will pivot into becoming a B2B. We have been creating our presence in social media and in the market through blogging, publishing articles, running pre-sales campaigns, and conducting live demos. Our eventual goal is to build loyalty with our customers. So here are the recent companies in the consumer space of brain, essentially. Now, if I am to zoom in into the ADHD market, you'd see that there's very few. And now if I compare those upcoming companies with the traditional ways and Dot, you would see that we have a wholesome solution to offer. I work with Dr. Rashida Chaudhry, who's a PhD neuroscientist at McGill University, and Nail Jazir, who's a gaming developer. And we are seeking an investment of $1 million to be able to launch our campaign, finish product development, as well as order the first batch of hardware to be able to get to $2 million in revenue by 2019. My name is Ishil Khan. I'm the founder and CEO of Dot, and we have the code to decode ADHD. Thank you.